Hey guys, now today I'm going to be taking you through my insurance policy, and I'm going to be sharing some tips and tricks, things that you need to be covered for and things that you don't need to be covered for, because insurance companies at the end of the day, when you sign up to a policy, they're going to try to get you on as much insurance and as much cover as possible. So my job as an insurance broker is, I want to get my clients covered and insured for what they actually need, rather than what they, don't have to pay for, okay, at the end of the day, because that's my job. That's obviously my goal is to save my clients as much money as possible, to really maximize what they're using and minimizing what they're not using. All right. So with my insurance policy, guys, I'm with a company called NIB. All right. That stands for Newcastle Industrial Benefits. All right. They're based out of Newcastle, as the name suggests. Now, the reason I'm with NIB is just because they've got, great dental coverage. Obviously, I have crowns and I have veneers, so I need to obviously really great dental coverage for maintenance for that, and that's why I selected NIB. But look, there's so many health insurance companies out there. Everyone has got their benefits and their advantages, and everyone's going to be suited to you differently as well. All right, so let's go through my cover with NIB. Now, in health insurance, you've got three types of levels. Okay, so you've got your bronze, you've got your silver, and then you also have your gold coverage. Now, my policy, I'm on a bronze level of cover. Someone my age, bronze is perfect. All right. If you're getting a bit older in your 50s, your 60s, your 70s, you may want to upgrade to a silver level of cover, or a silver plus. And then if you go to gold, that's a bit more specific, all right, as I'll go through right now when I go through the cover. Okay, now with my NIB policy, okay, with my hospital cover, with the bronze cover, I'm on a 750 excess, all right? Now, what an excess is in health insurance, guys, it works exactly like car insurance. Okay, you pay your excess when you go into hospital for a surgery or you use the coverage, all right? So the higher the excess, the lower your premium is going to be. Someone like myself, I'm fit as, I go to the gym, I juice, I take vitamins, I look after myself. So I don't need a really low excess, because I'm not going to be using the hospital cover, all right? Because I'm so fit. Okay, I'm so healthy. So what I've decided to do is increase my excess to 750. So that saves me money on my premium every fortnight when I pay it. So that's a trick that you can do as well if you're not using the coverage. But if you are using a lot, you might want to bring that excess down. But remember, with health insurance, guys, you only pay your excess once when you go into hospital, once a year. Okay. Now let's go through my bronze cover. All right, with a 750 excess. Now, guys, you need ambulance cover. All right, if you guys don't have ambulance cover, guys, you're playing Russian roulette. All right, to call an ambulance out these days, you're literally looking at thousands and thousands and thousands of dollars. So, guys, if you don't have ambulance cover, get it. It's included in your hospital cover. All right, so you definitely want ambulance cover. In the bronze, you have blood investigation, bone, joint, and muscle. You have the brain and nervous system covered. Chemotherapy for cancers, radiotherapy and immunotherapy for cancers. Dental surgery is covered. Diabetes management, digestive system, the ears, the nose, and the throat. Okay, the eyes are covered. Your endoscopies and colonoscopies are covered in bronze. Your hernia and appendix, and then your kidney and bladder, joint reconstructions. Now, don't get this mixed up with joint replacements. Joint reconstructions is under a bronze level of cover. So if you need to get your joint, your shoulder totally reconstructed, that's covered in bronze. Okay, lung and chest, the male reproductive system, pain management, and then you've got palliative care, rehabilitation. They're restricted services, guys. So what that means is you can use those services, but you need to be you need to be in a public system to use it. So you'll be a private patient in a public system. If you go into a private hospital to use your palliative care, your rehab, you're going to be charged a fortune. All right. And the last ones are skin, sleep studies, and tonsils, and adenoids and grommets. So that's what you're covered for in bronze. Look, that is a perfect level of cover, guys. You know, if you're in your 20s, your 30s, 40s, even early 50s, you could get away with a bronze level of cover if you're healthy. Okay. Now let's move on to the things that are not covered, all right, that you don't need, that, you know, when you're somebody my age, all right? So I'm not covered for, obviously, you know, your back, neck, and spine. I'm not covered for cataracts. Now, cataracts is in a silver plus level of cover. So getting that cloudy cataracts removed from your eye. Cosmetic surgery, dialysis for chronic kidney failure is also silver plus. Heart and vascular system is silver. Implantation of hearing devices, insulin pumps is silver plus. Joint replacements, that's silver plus. So people that are having cataracts and joint replacements, guys, these are more elderly. You know, my elderly clients that are 60, 70, and 80 are covered for joint replacements. All right, pain management devices, plastic and reconstructive surgery, pediatric surgery, obviously pregnancy and birth, I don't need that. Insurance companies are probably going to try to charge you for it. Weight loss surgery, etc. All right, now there's a couple of these that are actually gold. All right, so once you move up to gold coverage, the gold coverage is weight loss surgery, all right, pregnancy and birth, and also your pregnancy and birth, weight loss surgery, and also your hospital psychiatric services. So those three things, guys, are in gold. All right. All the other things I went through are in silver. Okay. Now, let's move on to the extras. Okay. So the reason I selected NIB was because with my extras cover, I get 60% back when I actually swipe my card when I claim. All right. So with my preventative dental, okay, I've got no limit on that. My general dental, so general dental are things like checkups and cleans and fillings, etc. And then you've got your major dental. So I've got $1,000 of major dental coverage. So your major dental covers things like root canals, wisdom teeth, extractions, implants, crowns, veneers, any maintenance on your teeth. Okay, and then I've also got my optical, and then I've got my physio. All right, so I definitely suggest, guys, having extras cover as well as hospital cover. Having those combined, they'll really give you a really high level of cover. A trick with health insurance is if you can try to get a percentage back, a percentage covered rather than a full amount, you're actually going to get better coverage as well. So if you guys want more information on what level of cover is going to be suited to you, whether it's gold, whether it's silver, or whether you're a younger, healthy person and you need bronze, let me know and I can get you some more information on that as well. Okay, you guys have a great day.